Hi everyone, I am Dr. Aung, a licensed general practitioner from Myanmar with clinical experience over 8 years. Today, I am talking about 7 simple tips for the persons with hypertension, especially when they suffer sudden rise in blood pressure. Tip number 1. Calm down, take a deep breath, and concentrate on breathing in and out. By doing this, you can become less anxious, and to some extent, it can prevent further rise in blood pressure. Anxiety, especially when you are suffering sudden rise in blood pressure, it can lead to faster heart rate. The faster heart rate means the heart is pumping the blood more quickly, and the more blood comes out from the heart, leading to more increase in blood pressure. So, if you are suffering sudden rise in blood pressure, just neglect the blood pressure numbers and staying calm, taking a deep breath, and concentrating on breathing in and out will help to reduce stress and anxiety, also prevent further rise in blood pressure. Tip number 2. Lying down without doing any body movement. The more you make body movement, the blood pressure will elevate more. If you move any part of your body, the heart has to work harder to supply the blood to the parts, and it can lead to further rise in blood pressure. So, if you are suffering sudden rise in blood pressure, lying down or sitting still will help to reduce the heart workload and also prevent further rise in blood pressure. Tip number 3. Take your regular blood pressure medication. Sometimes, the hypertensive patients forget to take their blood pressure medication for some reasons and remember only when they feel something uncomfortable. Lack of the action of the anti-hypertensive medication is one of the reasons for sudden rise in blood pressure. So, if you are suffering sudden rise in blood pressure and you haven't taken your blood pressure medication for that day, take it immediately. If you don't have any pill in hand, go to the nearest clinic or pharmacy. Tip number 4. Watch the danger signs of hypertensive emergency. High blood pressure or 220 over 140 mm mercury or higher is considered hypertensive emergency, and it can lead to target organ damage and life-threatening conditions such as stroke, heart attack, aortic dissection, vision problem, kidney injury, etc. So, if you are suffering sudden rise in blood pressure, you need to watch the symptoms of target organ damage such as severe headache, projectile vomiting, chest pain, reduced or absent urine output, vision problems such as blurred vision, weakness of the limbs, etc. If you notice one or more of these symptoms, you need to go to the hospital very immediately. Tip number 5. Don't take your blood pressure measurement frequently. If you are suffering sudden rise in blood pressure, you need to take some time to drop your blood pressure. And if you are measuring your blood pressure very frequently at the time, you will see only higher numbers, and it can lead to increased stress and anxiety, increased heart rate, and the more increase in blood pressure. So, if you are suffering sudden rise in blood pressure, don't take your blood pressure measurement very frequently. Tip number 6. Contact your family doctor. Your family doctor will give you the best advice how to manage yourself at home if you are suffering sudden rise in blood pressure. He or she will suggest you to go to the hospital if your condition is unsafe. Tip number 7. Go to the clinic or hospital immediately if you have some underlying diseases. If you are suffering sudden rise in blood pressure and you already have some underlying hormonal diseases such as pheochromocytoma or hyperthyroidism, you need to find immediate medical help. Pheochromocytoma is a neuroendocrine tumor that produces certain hormones abnormally, mainly adrenaline and noradrenaline. These hormones cause blood pressure to rise, the heart to beat faster, leading to life-threatening situations. The second, hyperthyroidism, is a disease of the thyroid gland, which produces thyroid hormones such as T3 and T4 to abnormally higher level. These hormones cause faster heart rate and sudden rise in blood pressure. These two diseases, pheochromocytoma and hyperthyroidism, are associated with sudden rise in blood pressure and sudden feeling of palpitations, and it can be fatal if these crises are not corrected in time. So, if you are suffering sudden rise in blood pressure and you already have these underlying diseases, go to the nearest clinic or hospital very immediately. These are the 7 tips that I always use practically for my patients with hypertension. If you are a hypertensive patient and if you are always worried about your blood pressure, these tips will be very helpful for you. So, if you want to know more about health knowledge, please like my video and subscribe my channel for upcoming videos. Thank you for watching.